Hey guys, this is Dr. Frank again with another video, and this time I'd like to tackle the topic of car accidents, which has become quite popular, especially during this time when when we're just starting to get our first snowfall. So there's a lot more accidents happening in the cities here. So let's talk about car accidents. Um, I apologize if I ramble a little bit here, but I never quite script these things as I should. But here we go. Let's talk about car accidents. I deal with about 20 to 25% of my patients are car accident patients. The rest are medical insurances, and the last are cash patients. But I've dealt with a lot of car accident patients in the past, so I have a little bit of experience in this, and I hope whatever this video provides, I hope it's just my 2 cents about this topic. So, car accidents. Let's talk about the reasons why people don't see, or why you should see a doctor soon after a car accident. I'll give you an example of one patient I saw, a new patient about a couple of weeks ago. She was rear-ended by another car. So what happened was she was at a stop sign, and then this other car came along and not only hit her from behind, but it was a smaller car, and he was going so fast that he actually hit her hard, and this car and her SUV went up into the air and came back down. So she not only had a whiplash injury, but she also had a very strong compression type force onto her spine. So she came in with really bad mid back pain, lower back pain, headaches, things like that. And so anytime I touched her back, she was very acute. So luckily she still had some MRIs from 10 years ago when she had her last accident. So I was able to order MRIs this time around, and we were able to compare the differences and what areas were affected in this accident. So kind of having to see any changes to a certain extent. Now, I felt comfortable enough to send her over to a neurologist, and so she's going to be seen by a neurologist as well. So that's more of a severe type case where she has a history of a car accident. She has disc injuries in the past. Based on her examination, she probably has some injured discs in there as well. Or the ones that were injured 10 years ago have become further injured. So they're worse off now. So that's an example of a small problem back 10 years ago becoming a bigger problem complicated by this recent accident. So my point is, we want to try and get you a fix, but we can't if you don't come to get your treatment, right? Or any doctor, right? So you want to try and address the problem when they're small, so that they don't become a bigger problem later on in the future. Okay, so that's one of the reasons why people don't go see a doctor, because they just kind of brush it off and just say, well, I'll be fine. A couple of weeks, I'll be okay. The other reason people don't see a doctor is because they don't know how severe it is. Typically what happens is you get into a car accident, you might go to urgent care or an emergency room, they'll take x-rays, and then they'll give you some pain medications and send you home. But in x-rays, especially with soft tissue injuries, you're just going to see the bone, but you're not going to see the disc, the tendon, the muscle, all those things that make up the soft tissue, to be able to see it and be able to diagnose it correctly, so you know what's actually going on, right? There's a bunch of people walking around with sprain strain injuries. I had a patient last year who came in with ankle injury, and I sent her out for imaging, and she turns out she had a broken ankle. Right, so I can't treat that at all. So I really hope that you guys get treatment before you come in, or at least come in right away, so we can send you out for imaging, so that I don't need to be injuring you guys any further. Okay, we don't treat broken bones here. That's the other reason. Sometimes people just don't know how severe their condition is. Sometimes when you have an accident, you don't have any symptoms initially, because people are just in shock. And it won't be until a few days later where symptoms start to appear. So you'll start to get neck pain, soreness, muscle pain. Be on the lookout for memory loss. You walk in and you just forget why you're in a room to begin with, or why you walked into this room. Something like that. So be on the lookout for something like that, where you have these symptoms appear, which may be caused from a concussion. from a car accident, right? So that's the other reason why people typically don't come in, is just they don't know how bad the injury is unless they go get treated or at least examined by a doctor. The third thing is inconvenience. People just don't like to go see doctors. It's a lot of, it might be a lot of traveling. It's time out of your day, but I really encourage you guys to go and see your local chiropractor or whoever is nearby you, whether it be a physical therapist or your family doctor, after something like this, right? Because you want to address the problem early. Again, going back to having a small problem not become a big problem later on. Okay, so the other reason is inconvenience. The other one, I guess the fourth reason would be the cost. In Minnesota, we have what's called a no-fault. So your auto insurance does provide medical coverage. So if you get into an accident, you can go see a doctor. You can go get these tests done. You can get some imaging done, and it'll all be covered under your car insurance. But the fear is that I've had this question where well, what's my premium going to look like after if I get treated, if I go and see this doctor or that doctor? And I really honestly don't know what to tell people, because I've actually talked to insurance agents and asked them, what happens in these situations? So the best I can tell you is talk to your agent so they can look over your policy and tell you if your premiums are going to go up or not. Generally, what they tell me is that if you get into an accident and it's not your fault, then your premiums won't go up. But again, you should talk to your agent and find out exactly what your policy says. Okay, so those are the reasons why people don't typically go see a doctor of any sort. But I encourage you to do so, to go and see a doctor so you can get properly examined, properly diagnosed, so that you can start a treatment plan. And the treatment plan, as long as you follow it, it should be shorter rather than longer, right? Especially, you should go see a doctor, especially if you have any complicating factors, or if you have a history, if you've had disc issues in the past, if you've had sprain strain injuries in the past, if you're starting to notice memory loss, constant headaches, things like that, radiating pain from your neck down towards your shoulders, or from your lower back down towards your legs, numbness and tingling, things like that don't seem normal, right? So I encourage you to do that, and ask as many questions as you can to your doctor or your agent or whatever, so you have a better idea of what's going on. Because if you don't, what's going to happen is insurance companies are going to cut your benefits, and then later on, you might have to use your own health insurance to get the proper care that you need, or you might have to pay out of pocket, right? And it becomes a lot more complicated later on down the line if you can't use those benefits that you have after a car accident. Okay, so I hope this video helps you out a little bit, and definitely go see your doctor if you are in a car accident, and I hope you don't get into a car accident. It's getting quite cold out there. Anyways, I hope this video helps you out, and if you have any questions, please give me a call, and stay safe out there, and I'll see you on the next video. Bye.